shouldn't be too hot, shouldn't be too cold. The best way to detect the temperature of the skin is by use of the back of the hand. If you notice how I'm touching the back of my arm, this is the way that you would want to detect the temperature of the skin throughout the body, starting at the top and going down to the legs and feet. And be certain that the body temperature is uniform throughout. Also, there should be the same coloration over the entire body. Color changes are dependent on the cultural heritage of the individual. It can range from a creamy color to a light pink to an olive color to deeper shades of brown. Dark-skinned people normally have light-colored areas in the whites of the eyes, the nail beds, the palms of the hands, and the soles of the feet. And frequently, color changes are easier to see on dark-skinned people in those areas. Good skin turgor, or elasticity, is another feature of normal appearance. By turgor, I'm talking about elasticity. When I pinch the skin on my hand, this is called tenting. Tenting, by pinching, when released, should resume the normal appearance and contour of the hand. If it remains tented, meaning remains pinched, after I stop pinching it, if it would stay pinched for, say, 3 seconds, that's an indication that there is a lack of hydration or a lack of moisture in the skin and that the individual needs to have an increase in fluid. Hair should be silky, clean, and non-oily. It also should be evenly distributed. The scalp should be shiny and free of itchiness or any scaliness. Fingernails and toenails should be oval-shaped. They should be smooth, evenly trimmed, clean, and free of any hangnails or other problems in the skin surrounding the nails. Now that we've talked a little bit about some normal features of the skin, I'd like to focus now on what might be abnormal that you might detect. This list is not complete, but it will include some of the major features of abnormal appearances that you will see. The first are color changes. Color changes are best seen where pigmentation, or the color of the skin, is most scarce. Color changes on light-skinned people are easily seen throughout the body. As I mentioned earlier, on darker-skinned people, it's easier to see color changes in the whites of the eye, on the lips, on the nail beds, on the palms of the hand, and the soles of the feet. There are 4 color changes that I'd like to talk about. The first is called cyanosis. Cyanosis is a bluish color to the skin, and that's caused by a lack of oxygen to the skin. The next color change that is abnormal is a flushed appearance, and flushed skin is a reddish pink color, and it's caused by rashes, fever, sunburn, or any number of other problems to the skin. Also, a third color change that's abnormal might be a paleness to the skin. We sometimes call that pallor, and it's where the skin looks white or ashen, and it's caused by a lack of blood supply to the skin. The last is called jaundice. Jaundice is a yellowish coloration of the skin and whites of the eye that are caused by liver disease sometimes, or gallbladder disease. You also might know that yellow pigmentation or coloration can occur, particularly I'm thinking of small children that eat lots of carrots. That, of course, is not abnormal, but it would be if the person had a jaundice due to a disease process. Another abnormal finding that might be on the skin would be some lesions or sores. If you remember earlier, we talked about one of the main features of the skin was its protection of internal organs. If there are sores or lesions on the skin, no longer is that skin intact, and as a result, germs can get in to the internal organs and cause infection deep within. Rashes are another problem. You notice the rash in this particular picture is where it's a rash underneath the breast. Rashes of this nature happen when there is skin against skin, and moisture can result underneath. And under breast tissue such as this is a common but abnormal feature for skin by the development of rashes. Drainage can be also an abnormal feature, and there can be drainage that comes from a nipple area, for example, or it could be from a wound that's draining, or any number of other things. The skin can be dry and scaly. That too is an abnormal appearance. There can be blisters or skin tears. There can be an excessive amount of moles, or might not be excessive moles, but there could be suspicious moles, suspicious for the possibility of a cancerous mole. Suspicious moles usually take on a variety of colors. Within the mole itself, there can be red portions to it, there can be black, there can be brown, usually not uniform in color. There also can be irregular borders to a mole. That's an indication that it is not normal. Alopecia is a term that we call for hair loss. Hair loss, if you remember, can not only be from the head, but can also be from the legs and other parts of the body. It's extremely important to report these abnormal appearances of the skin immediately to the nurse. Why is that so important? Well, early detection and early intervention for some of these problems is critical to be able to turn around some of these problems and to decrease the risk of deeper problems developing. An instance comes to my mind. Let's just say that you're bathing an individual. You turn them on their side after you've washed their front side, and you're just about ready to wash the back, and you notice that the heels of both of their feet, when you've turned them, are reddened. Well, that's not so unusual, is it? Whenever there's pressure on an area, it tends to get reddened because there's a lack of blood supply to the area.